Hello, everyone. I'm Dr. Atoosa Kourosh with Holistic Allergy and Immunology, and I'm coming to you live from my office today to promote Sleep Awareness Week, which is this week, and to give you some tips and tricks on sleep promotion, as well as discussing the science of sleep with some of my colleagues. My colleague, Dr. Brian Robertson, and I are going to talk to you about sleep. We have been invited to speak at the American College of Allergy, Asthma, and Immunology 2024 annual meeting on this topic, You Snooze, You Win, and how integrative medicine and holistic medicine techniques, as well as cutting-edge techniques from mainstream medicine, are used to promote sleep. So I'm going to invite up Dr. Brian just now, and he's going to join me, and we're going to I've been posting all week some sleep tips. There's some really important things that people need to know about sleep and the immune system. For instance, did you know that if you just have one night of disturbed sleep, that it can actually alter your immune system function, your cellular function of the immune system? That's including your white blood cell function and your capacity to fight infections. It can also affect your capacity to promote actually a good response to vaccination. And so we're going to talk about all of that, and that has to do with how your immune system is affected. Also, sleep disturbance has been can affect your microbiome. Just one night of disturbed sleep can affect your microbiome in such a way that it can actually promote autoimmune and other kind of inflammatory diseases. So I'm going to invite up my colleague, Dr. Brian. I see that he's joined. Welcome, Sharon. Welcome, Danya, my medical student, is here, and Bella, who works with me on social media. Thank you so much. Public health is in the house, and I'm actually inviting Dr. Brian up right now. So we're also open to taking questions from everyone as well. So if you have any questions about sleep and the immune system, we're happy to answer them. So there are so many things you can do to promote sleep. One of the most important things is to have a normal sleep schedule. And I've been trying really hard to get Dr. Brian up here. He's in the audience. I see you, Dr. Brian Robertson, and I'm trying to invite you up. In fact, I did send you an invite. So look for the invite and come on up if you'd like to join us. So what kind of things do you do to promote sleep? And what have you tried? So my friend and colleague, Yoga Diva, is here, and I know that we have worked together on yoga and sleep techniques before. So yoga is a big part of my sleep practice. So I do breath practices, pranayama, from the yoga therapy lineage to promote sleep, and I do some sequences of yoga asanas or practices that help with the body and getting the body ready for sleep. So I do all of that. I'd be interested to see what kinds of things everyone does to promote sleep. Do you have a favorite practice? One of my favorite practices is I have a bedtime tea that is made with chicory root, because it's caffeine free, and rooibos, which is also caffeine free, and it's an African bush tea. And I have kind of a chai, so it's like made with cardamom and cinnamon, and it really is very calming and delicious. And sometimes I mix it with a plant milk like coconut milk or almond milk, and that has helped me in the past to promote sleep, and it kind of signals me that I need to sleep. And the other thing that is really useful is that I turn all the lights in my place down. So I only have a few soft lights on. There is some science in sleep, science that shows that that period of time where it's just about to get dark and then it suddenly gets dark, there is a little bit of awakening that happens. And that is because in our primitive hunter-gatherer days, if the sun was going down, in that hour right around sunset and after sunset, we needed to mobilize and get to safety and get to our caves and get to our shelters. And so we have a period of wakefulness and energy right around the time of sleep. So sometimes if you're turning all the lights off, that moment you suddenly feel wide awake. So you need tools to help you sleep in that moment. Dr. Brian, are you having difficulty coming into the live? I have sent you some invites a couple of times. So look and see if you're being invited to join. And also you can send me an invite to join. So please don't hesitate to come up. I don't know what that was about, but there's things populating the screen that I don't actually know. No coffee or walk dates. Oh, I don't know what's happening there, but I'm going to try to erase these from the screen. Sorry. And doing my yoga breath practices and my yoga postural practices, asana practices before bed, and even some meditation. The other thing that helps me tremendously is hypnotherapy, and I actually have a post coming up that explains my sleep routine, and that'll be going up in the next few days. So be on the lookout. Oh, Bella says she lost my audio. How about now? Can you hear us now? Hi, Brian, are you there? Oh, it's back. Okay, my audio is back. It might have just been my internet. And I think Brian is joining. Hi, welcome.
Hi, how are you?
Good.
Okay.
So now that you're here, I think we should introduce ourselves over again. So
Okay.
I'm Dr. Atoosa Kourosh of Holistic Allergy and Immunology. This is my colleague, Dr. Brian Robertson. Brian, do you want to introduce yourself and tell us where you are and tell us a little about your background?
I'm a sleep medicine doctor and an allergist. I was in the Army for a long time and I retired from the Army about 3 years ago. And now I do have
Thank you
like
for your
5 different part-time jobs. So, but I work as my main job is working as the chief medical officer for a small medical device company that is in the sleep space. So that's what I do.
That's
And
awesome. Well, I'm so glad you found that. And thank you for your service to our country.
oh yeah, absolutely.
So one of the things I was going to talk about is all the things that get in the way of sleep. So for us, being doctors, right, we've worked night shifts, we've worked in the hospital, we've done training. The training programs of medicine definitely disturb our sleep. Did you find that the military disturbed your sleep, or did it get you on a good regimen? Because I've heard both from other veterans.
So there's been 2 very large studies looking at the hours of sleep that people in the military get. And what we find is that over half of the people in the military actually do not get more than 6 hours of sleep. So you need 7 to 8 hours of sleep a night. Your grandmother was right in that you need 8 hours in bed because, it takes a little time to fall asleep. You might wake up from time to time. You really need right around 7.5 hours for optimal health. Less than that increases your risk for all kinds of problems, including dying early, but also dementia, heart attack, stroke, diabetes, obesity. There's all kinds of problems that come along with a lack of sleep. So
Yeah.
yes, it's very important. And at least in my experience in the military is that you didn't get enough sleep. There's a long tradition of waking up very early to do your job, which all the sleep doctors we have tried our best to convince the military, and I think we're actually getting there that we need more sleep and for that population. So, and that it
Yeah,
improves
definitely.
performance.
And I'm definitely worried about it because my nephew is a Marine. He's based in Okinawa, and I felt like even actually from the time he joined officer training school, which was like 2.5 years ago, I feel like he hasn't gotten adequate sleep. in the past 2.5 years. So I felt like officer training school was dramatically awful for his sleep. Boot camp was dramatically, or what do you call it? Basic school was terrible for his sleep, and now deployment has been terrible for his sleep. So
Oh
I
yeah,
really
yeah, yeah,
think about
absolutely.
that with our GIs, because now we're a Marine family and we have a personal connection as well, but all of our military that's keeping us safe, and our doctors and medical personnel, nurses and doctors that are keeping us safe, are the most sleep deprived people. And one of the other things I was talking about before you joined is that the microbiome disturbances of sleep
Hmm.
deprivation have been linked to breast cancer and other cancers as well. So I think people don't realize that lack of sleep can literally kill you. And you talked about the other things like the cardiovascular disease, the obesity, the diabetes, and the risk of just sudden death from various causes is also increased with sleep deprivation. So that is the other thing that people don't realize. And it's not just accidents because you're sleep deprived and you're not driving well, or you're not operating machinery with as much vigilance, but just that your body's systems literally do not function when you don't get enough sleep. So I wanted to talk a little about the science of sleep, and about not just, we talked a little about the health risks of not getting sleep, but I wanted to talk a little about the science of sleep and what all the different phases of sleep are and why they're so important. Because this is Sleep Awareness Week, and I think people
That's
think
right.
that if they just, if they get 5 hours in bed or 7 hours in bed, that's how much sleep they got, or that's how much rest they got. And so, Brian, do you want to take us through a
Sure.
little of the basics of sleep and what it takes to really maintain health, like the different aspects of sleep and how they support our mental and physical functioning?
Yeah, so there's four stages of sleep. We've divided them up that way. So there's light sleep, and we usually spend very little time in that light sleep stage. Can you hear me okay? Sorry.
Yes.
It's fine. Okay. So we spend very little time, about 5% of our sleep in that light sleep. And this is kind of like twilight. This is where um, you are drifting off to sleep and you are asleep, but it's not very solidified. And it's very easy to wake somebody up from that. Um, and then there's the second stage of sleep we call stage two sleep, which is moderate sleep, and that's about half your sleep. And then the deep sleep or stage three sleep, which is about 20 to 25% of your sleep. And then finally, rapid eye movement sleep, which is about 25% of your sleep too. So all the stages are important. We move quickly through. When we fall asleep, we actually sleep in cycles that last roughly 90 to 120 minutes. And those cycles, you start with deep sleep. You actually go into deep sleep very quickly. When you fall asleep at the beginning of the night, usually within about 30 minutes, people are in deep sleep. And then they're in deep sleep for a while, then they go into REM sleep, and then they wake up. And everybody wakes up at the end of REM sleep. And then you fall back asleep. Now, a lot of times we don't remember falling asleep, or waking up rather, because you're not awake long enough to actually form a memory of being awake, but you do wake up, even if it's only for a few seconds. And then you repeat that cycle. And as the night goes on, it does change. So as the night goes on, you get more and more REM sleep and less deep sleep. So the deep sleep is very predominant in the early part of the night, and in the last half of the night, there's a lot more REM sleep. But both are very important for your function. One of the really important things, and this is for an allergy audience, is that when you're in deep sleep, that is when you actually make growth hormone. And so, if you want to get bigger and stronger and faster and be healthier, like having the normal amount of growth hormone is very important. Famously, a lot of bodybuilders have learned this and they will go to great lengths to increase their deep sleep because it's growth hormone. It makes them bigger and stronger, and it makes it easier to be a bodybuilder. So this is not a new thing that we know. We've known this for a long time, but that's really important. REM sleep is really important for memory consolidation. So we know if we interrupt people's REM sleep, so what we can do is there's been experiments where you put people in a lab, and then when they go into REM sleep, you wake them up. And every time they go into REM sleep, you keep waking up. And then you do tests of memory, and you compare those to people that were able to get REM sleep. And what we find is that people with the REM sleep deprivation actually perform worse on memory tasks. So it's
Uh,
important to.
these are such great points. And I remember early on when I was trying to restructure my sleep, because in my mid 30s, I went through, I was in a job situation that was really awful. And I
Mhm.
was getting like 23 pages a night. Like
Right.
my pages would go off all night, and I was covering two hospitals and a clinic. I was, you know, a bunch of my colleagues either left, went on medical leave, or went on sabbatical, and I went from a practice that was supposed to be with 7 pediatricians. This was in my previous life before I went back to fellowship and became an allergist. I was a general pediatrician, and I was covering the work of 7. There were 3 of us covering the work of 7 pediatricians. So it was really awful. And I had like really long standing difficulty. Even the nights that I wasn't on call, I couldn't sleep. And I had awful insomnia. And it led to a lot of, you know, mood issues, a lot of, you know, health issues. My allergies were out of control. I had terrible reflux. Like my microbiome was very messed up. So anyway, I went to sleep medicine, and I went through a period of sleep hygiene. So when we talk about sleep
Yep.
hygiene, people don't know what we mean by that, but it means to have a very structured bedtime routine and have things that promote sleep in the hours before sleep, not just right at the moment that you decide to sleep. But when I was going through that, I remember trying to structure my sleep so that I would sleep in 90-minute increments, like not sleep for, I sleep for 6 hours rather than 7 hours, or
Okay.
sleep for 9 hours rather than 8 hours. And what can you speak to the science of that? And is that really a thing? And does it really matter? And it's getting interrupted in the middle of a 90-minute REM cycle or sleep cycle? Is that bad for you? And what can be done about that? And then what about the too much sleep idea? Because some people say there's too much. Like I feel awesome when I sleep 9 to 9.5 hours, and people have routinely told me that's too much sleep, but I don't
Um,
think that is. So can
yeah, yeah,
you
that's a
speak
good
to
point.
that?
So, and I'll speak to the last one first. So, getting too much sleep is almost impossible for working adults in our country. Like
Yes.
that is not something we really worry about. We're always worried more about the people that are only getting 3 or 4 or 5 hours of sleep at night because they're obviously impaired, and the longer that continues, that goes on. There was a study back in the 90s where at NIH where they were looking at sleep patterns because we all sleep in one big chunk, and animals tend to do it in 2 chunks. So they have a first sleep and a second sleep. And in some um, cultures that are, you know, uh, like not native cultures, but they're not advanced. They're primitive societies. They will often sleep in 2 cycles like that too. So there'll be a first sleep. They'll wake up. They'll do things in the middle of the night and then go back to sleep again.
Yep.
And what they were doing in this study was looking to see if people would naturally do that. They do. So if you put people in bed for 14 hours in a row, they will gradually change to this first and second sleep pattern. But the really cool thing about this study was that it took the participants, who were healthy volunteers, about 3 weeks to get to the point where they were only sleeping 8 hours. At first, they
Wow.
were sleeping about 13 hours. And it took them about 3 weeks before they had worked off all that sleep debt, right? So there's
So
this idea of sleep debt.
this is
That,
great. So you
yeah,
can bank sleep and you can pay off sleep debt, because that's the other thing that
yeah.
is passed around a lot, is that once you've lost that sleep, you're done. You can't get that sleep time
It
back.
seems like you can.
That's great
There hasn't
news.
been a ton of research on it, but yeah, that is the truth. And sleep baking is something I learned to do actually when I was in the military. We would promote this with like special forces. They would actually be the ones that we would do this because they knew they were going to be awake for 24 hours or 36 hours, 48 hours. What they would do is get extra sleep beforehand, so they're they were going to be impaired because of it, but not as impaired as if they had not done the sleep banking.
That's
So,
amazing.
yeah,
That's
so you
amazing.
can sleep bank, but no, don't worry about getting too much. It's almost impossible.
That's
Um,
That's what I think too. And but people tell me, oh, if I get too much sleep, I'm sluggish and I don't feel well. And I'm like, no, I don't think it's that you got too much sleep. I think it's that you woke up in the middle
in
of
the
a
middle of
deep
the REM,
cycle instead of at
exactly,
the end of a REM cycle. Like I try to tell them it's not that they got too much, but that they woke up at the wrong time in their cycle or got up out of bed
exactly,
at the wrong
exactly.
time. Yeah.
Yeah.
So
Now there is an idea like if so we do have studied people that sleep for long periods of time, like 9 or 10 hours a night, and they actually have increased risk of morbidity, mortality, and all those things like obesity and diabetes and things like that I mentioned earlier. But we think that is a consequence of the fact that they have those problems and not a cause. So the short sleep can cause these problems, but long sleep is a consequence of that. If you've ever seen patients that have autoimmune disease, one thing that you can say about someone with multiple sclerosis that I think I could say that about every patient with multiple sclerosis is that they are tired,
Yeah.
they are fatigued. And it's because of the inflammation in their body that's causing that. So it's a bidirectional relationship between sleep and immunologic health.
Say that again. Say that again, Brian. It's a
It's a
bidirectional relationship.
bidirectional thing, right? When we get
So the
when you
less you sleep, the more likely you are to have immune dysfunction. And the more immune dysfunction you have, the more likely you are to have sleep disturbance. That's what
yes,
you mean by the bidirectional
that's
relationship. Is that right?
exactly
And I
exactly.
think
These
this is
affect each
something
other.
that we cannot stress enough. And we're going to actually, I don't want to scoop our presentation too much, but Brian and I are presenting at a national conference of our specialty, of our allergy specialty, on this exact thing, on sleep and the interaction to the immune system. And that's why I titled this talk "You Snooze, You Win," because that was the original proposed title of our talk, of our symposium that Brian and I are speaking at. And we're coming at it from two different aspects. So Brian is going to talk about sleep technologies, like the technologies that assess and promote sleep, and the research that shows what works. And I'm going to talk about it from the traditional and alternative medicine perspective, complementary and alternative medicine, integrative medicine perspective. And that's because I'm chair of the Integrative Medicine Committee of the American College of Allergy, Asthma, and Immunology, and Brian is chair of the Sleep Disorders and Respiratory Disorders Committee of the American College of Allergy, Asthma, and Immunology. And so we've collaborated on this symposium, and we're collaborating on this live, and maybe we'll do one more live just right after our symposium as well, in several months. It's coming. It's not till October, but we wanted to do it this week because it's Sleep Awareness Week. And so I encourage you guys, 6 or 7 people have joined this live. If you have questions, please don't hesitate to drop them in the chat and invite others to the live who might want to learn about sleep. So one of the things, one of my my social media assistant asked me is, are you going to do a sleep live? And I was like, yeah, I want to do it. And we were scheduling it. And one of my friends was like, oh, why are you doing a sleep medicine live, like in the middle of the day? Why aren't you doing it like at night? And I'm like, well, because I don't want to disturb anyone's sleep, because then they're going to have to look at blue light like at 9 p.m. and disturb their sleep. So
Yeah,
that's why. So can you just talk a little about
yeah. Blue light.
technologies around, the technologies that make our lives possible the way that we live them now? And I'm not knocking those technologies, but I'm reading a book called Stolen Focus, which is about how our technology is designed to steal our focus. But there's a whole chapter in there about sleep disturbance as a result of technology exposure. And so I wondered if you could talk a little about that, and also talk about the technologies for sleep monitoring, which have become all the rage, wearable tech, right? Like we're the technology age where people are talking about getting tech implanted into their brains and into their optic chiasm, and into their optic neurons. The cyborgification of humanity is coming. But where we are right now, I'm probably not going to get it, never say never, but I'm probably not going to get any kind of tech implant. But where we are right now, how does tech interface with sleep? And both in a good way and a bad way.
Well, the bad way is easy, so we'll start with that. The bad way is that we extended the daylight hours basically with electricity, right? And if you've ever been on an extended camping trip, which I've done before in my life, 2 or 3 weeks, what happens is that you notice is that when the sun goes down, you go to bed, and when the sun comes up, you wake up, and you start adhering really closely to the natural rhythm of the day, because when it's dark, like even if you have flashlights and things, it's just not as good, and you don't really have any reason to be awake, and it's hard to do things with flashlights, so you just go to bed. Now, I think that's important to remember too, so because when we have electricity available to us, it can be daylight 24 hours a day in your home. You can do that. It's very easy to do. People do it all the time. And so turning off the lights, detaching from technology so that you can relax your brain. You mentioned you have to relax first, and that is something we always tell our patients that have insomnia, is that you're like a plane up at 30,000 feet, and you got to get on the ground first, right, before you can stop. And if you think of sleep as stopping, you have to calm down first. You have to come down to the ground. And that means relaxing and unwinding, doing something that is not work for sure, something that's relaxing to you. A lot of people watch TV doing this, and that's okay. Um, Reading probably was a little bit better, but something that's quiet and relaxing for you before you go to bed.
And
Now,
reading, I have the paper books, like the books, like the hardback and paperback books on my bedside table. I try not to read with digital media before bed. That's the other thing.
yeah,
So,
yeah. So, reading it old school, I guess, right? So
yes.
and a lot of people have Kindles and things like that. Now, there's two kinds of Kindles. There's the ones that emit light and the ones that don't. The ones that don't, that's just like reading books. And we've actually
Right.
studied this. There's no blue light coming off of it. It doesn't affect your sleep. When you look, there was a study done about 5 or 6 years ago where they had people read on a screen that emitted blue light and then just books. And then they also had a third group that read on Kindle, but it was the e-ink, and it wasn't backlit or anything like that. And they just had them read before they went to bed, and then they monitored their sleep. And what they found is the people that were exposed to blue light had less sleep satisfaction, so they didn't feel as rested when they woke up. They didn't feel restored, or as restored, and then they had more sleep fragmentation during their sleep. And it also took them a little bit longer to fall asleep. So yes, one thing we do if people are having trouble falling asleep, one of the first things we do is like tell them like you need like about an hour or so before bed at least, and ideally even like 2 to 3 hours. Like you got to get away from blue light. Now there are like blue blockers that are effective too. So these are reading glasses, and they're kind of this orange tint. And people, you might see those. You can buy them almost anywhere, and they'll block the blue light. So that you could use a tablet or a screen if you wanted to read on that. That would be okay, because you're blocking the blue light. What does the blue light do? So the blue light it's actually a blue-green light that is what it does is it interferes with the production of melatonin. And melatonin is a sleep hormone that we naturally produce. We start making it about 3 to 4 hours before our natural bedtime, and it peaks during the night and then drops and then goes away before you wake up. You can replace.
Brian, I lost your audio. Brian?
We good?
Yeah,
Yeah. Okay.
I lost your audio briefly, but you're back.
Oh.
Okay. Okay, so
Yeah.
you can take melatonin to mimic the natural cycle, and here opens another controversy, right?
Right.
So there's some research that says, especially for women in perimenopause or postmenopause, a little bit of melatonin is actually not a bad thing at night, because melatonin production is what decreases, and it's one of the sleep disturbance related hormones, hormonal fluctuations of perimenopause. And that even this happens in menopause, right? So when men go through the midlife, which it's not as as dramatically outwardly seen or talked about as much, but it happens. So in older people, a little bit of melatonin might not be a bad thing, but there's some data that suggests that there can be melatonin dependency, because the dose of melatonin that's given in the exogenous form, or the type we take over the counter, is so much higher than what our pineal gland actually makes, that it can kind of suppress our natural melatonin production and make things difficult for us if we want to come off. So that's a whole thing that is talked about. And what do you think about that? I'm inviting up Dr. Emmy, who's actually joined us as well, if she wants to join. Dr. Emmy, we're talking about sleep medicine with Dr. Brian Robertson, who's a sleep medicine specialist as well as an allergist. Hi, Dr. Emmy.
Hi.
Looks like you're kind of in a noisy place and we can't hear you.
Yeah, I'm gonna mute, but I will basically stay on here so my followers know that you guys are on.
Oh, thank you so much, Dr.
Great.
Emmy. Dr. Emmy is my older sister and a really amazing functional medicine doctor who works a lot on sleep and has helped me actually a lot with my sleep over the years. So go ahead, Dr. Robertson. Talk about melatonin, and I asked you the question about exogenous melatonin, or the melatonin we take, and is it good for you or bad for you, short term or long term? These are the questions.
So most of my patients, we use it for short-term adjustment of your circadian rhythm. That's our primary use for it. And so what we want to do is people that are night owls that have to get up early in the morning and have trouble waking up to go to work, or school, what we will do is try to adjust their circadian rhythm. It's hard to do, and they have to be really diligent about it. But you can think of it two things. So, what are the things that manage your circadian rhythm? One is melatonin production, and the second thing is light. And so we use light to push sleep earlier. So you want bright light exposure in the morning when you wake up. And then melatonin, you want melatonin kind of pulls sleep back, right? So you want to use melatonin, um, typically a dose, a very small dose, actually 1 to 3 milligrams, and you don't need a
That's
whole lot of it. Yeah, you don't need a whole lot of it, but we have our patients take it about 3 to 4 hours before their desired bedtime. And then we have bright light exposure in the morning, and those things will help adjust your circadian rhythm to match what the patient desires their sleep pattern to be. We always think of like a sleep window, and when we're manipulating that, those are our two big tools. You mentioned melatonin. Melatonin, not commonly, but it can cause really vivid dreams and sometimes nightmares. But I think it's less nightmares. In fact, that whatever your dream is, it's going to be a little more intense when you're taking melatonin. Um, we don't want to use a lot of it, and I know that melatonin can be sold at like 10 milligram, 15 milligram, I mean, huge doses. The problem with that, it's not that it's necessarily bad for you, it's that it doesn't get metabolized very quickly. And so you'll get this hangover effect in the morning if you take a massive dose of melatonin at night. There is one condition that's called REM behavior disorder where we use high doses of melatonin, but that really is the only time when we would recommend taking more than 3 milligrams a night. And really importantly, I think the other thing you have to remember is people often take melatonin at bedtime. Is the wrong time to take it. You need to take it earlier, much earlier. So taking it 3 to 4 hours before bed or your desired bedtime is the way to do it.
So I'm going to agree with you on a lot of that, and then I'm just going to give a few of my tips, my own tips. So number one is that the form is important. So I have had people take sustained release or extended release melatonin, and that hangover effect is way worse.
Yeah,
And the induction
absolutely.
even takes longer. So
Yeah.
someone will take extended release melatonin at like 10 p.m., not be able to fall asleep till 1 a.m. and be very, very tired the next day. And that's a problem. The other is that I've had people tell me that when they take melatonin, they are not quite asleep. They feel like they're in a state between sleep and wakefulness. And that's where they're having kind of an atypical reaction to melatonin. This is
Hmm.
beyond vivid dreams. They are completely cognizant, but feel
Hmm.
almost like a sense of sleep paralysis, which is
Hmm.
what happens to us when we wake up in the middle of REM sleep, is
Yeah.
sleep paralysis. Like we're awake, we're alert. We maybe even kind of know the difference between reality and sleep, or dreams, but we may not even know, like that can be blurred. And so I am very cautious. And if someone has that reaction, then I don't use extended release. Actually, I almost never use extended release. And I may use a sublingual liquid form rather
Hmm.
than a tablet form, because under the tongue, the circulation picks up, the capillary circulation of the blood vessels under the tongue can pick up and put it into the bloodstream and get it to the brain faster than if it goes through the digestive route of absorption. So I tend to use liquid, and I tend to use it
Hmm.
a little closer to sleep time when people have had other issues with melatonin, like either that it doesn't work or it works in a weird way. And the other thing is that I don't rely as much on melatonin as I do on magnesium and L-glutamine or other GABAergic is
Hmm.
what we call them, the GABA-inducing types of supplements. And I would love to hear your take on that, but I use a cocktail of magnesium, chelate, malate, and threonate that Dr. Emmy helped me formulate for myself.
Uh-huh.
It's through a supplement line that I trust, Vibrant Science, which
Hmm.
is third party tested and can be sold in Australia. And this is something I talk about a lot, is when you're looking for supplements, make sure they can be sold in Australia, because their Therapeutic Goods Administration does the due diligence that our FDA hasn't been able to do on supplements, right? So that's the other thing. And then the other, and this is true of everything, even including over-the-counter supplements like melatonin. I make sure that that the brand I'm using is third-party tested and can be sold in Australia. And
Yeah.
again, I also use melatonin only to reset circadian rhythms, or such as in the case of jet lag or travel, or other reasons that sleep has been disturbed. And also I have used Roserum, which is like a melatonin agonist, or it actually works on the melatonin receptor, but again, in very rare cases and for very short time, because again, that's like a super melatonin, or it's like a super melatonin effect.
Right.
So I try not to use that. And so I would love your take on, say, L-glutamine, GABA, other things that are used for sleep, CBD, that's another thing that's used for sleep, magnesium, anything else?
Yeah, the first thing you mentioned, like getting a reliable source of melatonin, which is a major issue actually, because it
Yes.
is not regulated as a supplement, and supplements, there've actually been like sampling where they've taken samples of melatonin from various manufacturers, and the dosing, the actual amount of melatonin in those pills varies widely. There's a company called Nature Made. I don't own stock in them or anything, but I know that they are they sell this in Germany and they sell it in Europe, where melatonin is regulated as a drug.
Yes.
And they tend to be much more reliable than other brands. And so that's the brand I typically recommend to my patients. As far as other supplements, we don't really use a lot of them. Honestly, the thing that we do the most for people with insomnia problems is cognitive behavioral therapy for insomnia. It's the gold standard treatment. It works better than anything else. We don't have to give you any kind of medications or supplements or anything. Like, it is simply behavioral and cognitive techniques to improve sleep. And so you're going to hear me talk about things like winding down before you go to bed. Not reading in bed is another thing. So don't use your bed for anything except for sleep and sex. That is literally the first thing I tell patients to do when they come to me with complaining about the fact that they can't sleep or either fall asleep or stay asleep.
You're
So
right. That's
we
so important.
I think I might be even more holistic than you. We have this aversion to medications, and the fact of the matter is like, if you take a medicine like Ambien or Lunesta, it does work. I'm not saying it doesn't work. It absolutely does. The problem is that the effect goes away. The effect goes away with those things, and like you fail, right? And so then you can try something else, but a lot of times those fails too. And it's because you're stimulating receptors that will downregulate, and we're all allergists, so we know about cell biology, and this is what happens to receptors all over your body, is that if you overstimulate them, they downregulate. You don't have as many of them available to you. So it's not a great solution. We use the medicines, but we use them for very brief periods of time to get patients like a quick win, so that they'll believe us when we tell them that they have to make behavioral and cognitive changes to improve their sleep.
Oh, I'm definitely super holistic, and I cannot, I can't. It's been more than 10 years since I've even prescribed anything for sleep for anyone. But I will occasionally, counsel them on supplements. And also there are supplements that are more stimulatory. So people are taking, for instance, or can disturb sleep. And this is something people don't think about. Like, I'm all for you taking vitamin C or B vitamins or whatever, if they're a good source, and if you feel like they help you. But if you take them close to bed, then you might have to wake up in the middle of the night to go to the bathroom. They actually tend to create some people tend to have to pee, have to go urinate shortly after they take vitamin C or vitamin B. So I talk a lot about careful supplement timing if they're gonna do that, so that it doesn't disturb their sleep. And then the other is that I am also a internationally board certified clinical hypnotherapist. So I do help through hypnotherapy with sleep induction. I use it for myself, and I've used it for my patients for sleep induction and for sleep maintenance. And there's a lot of hypnotherapy recordings out there. Some are right for a lot of people, some are not right for everyone. I generally recommend getting a tailored hypnotherapy practice created for you by a board certified hypnotherapist if you're going to do that. And there is a kind of a very gradual transition during that from a hypnotic state to a sleep state. And I find it really induces deep sleep for me and helps me a lot and has helped a lot of my patients. But going back from like the traditional and holistic methods like hypnotherapy back to technology, what about like these wearable tech things? Like,
oh yeah, right. Sorry,
yeah,
we jumped ahead. So wearable tech. So what you have to think about what they're doing. So what is the Fitbit or the Garmin or this thing that you're wearing on your wrist doing for you? What is it doing? Well, it's measuring stuff, right? And it's just measuring things. And just like a blood pressure cuff measures your blood pressure, these things are measuring various aspects of your sleep with varying degrees of accuracy and precision. All those and you'll get a lot of numbers. And so that's fine. Now, the next step is the really important part. Like, what are you going to do with the numbers? So if I generate a whole bunch of numbers and then you don't make any changes in your sleep patterns, like it doesn't really help you. So I only recommend those devices to people that understand that there's going to be night to night variation in those numbers that they're going to get, that they're not going to get too anxious about a change that they see as detrimental, that it's just one night, and that they have to take a long view of their sleep. They can be helpful. I mean, I do have patients that like them and that it alerts them to problems that they weren't maybe realizing that they were having. And so then they can pay more attention to it. But it really comes down to those techniques that are tried and true techniques to improve your sleep. And they're all parts of behavioral therapy for insomnia. You have to do those things. So measurement's great, but you got to intervene too.
That's true. And I think that's a really good point. Like people that wear the Aura ring, or there are these like sleeve vests that you can do. And then taking another leap into sleep study territory. What about the home wearable tech for sleep studies? How does it compare to a sleep study done in a lab? Nowadays, I think almost everyone is getting home sleep studies since the pandemic. And do you want to comment a little about that?
Yeah, so I practice sleep medicine at a large company, and we almost every patient, no matter what your problem is, gets a home sleep test first. And it has to do with cost and availability. In-lab sleep studies are very expensive, and home sleep tests are not. And so it is, when you have you have to think of it from a public health perspective, that there's not enough sleep doctors in the world to take care of all the people's sleep problems. And we have to find better and faster ways to get help to people that need it. The home sleep tests are great. They test for sleep apnea, and they only test for sleep apnea. They don't test for other sleep disorders. So you really have to have that one problem. And they tend to be a little less sensitive than the in-lab sleep studies, because we don't really know exactly when you're asleep and when you're awake. We sort of have to guess based on respiratory patterns with the home sleep test, which can be a little tricky to do.
Yeah. That's really great information. Thank you. And then the last thing I wanted to touch on, because we've been going for about 40 minutes, and I do want to be mindful of that. And I really appreciate you taking time, and also Dr. Emmy joining us. The other thing I wanted to just briefly touch on is that people think that if they have gotten off track with their sleep, a lot of people tell me that they feel like they can't get back on track. And I, as a night owl who is not a morning person, I've experienced that myself.
Sure.
And maybe top 3 things you think are most helpful for getting on track, and how long it takes to get on track. So this is the other thing, is I feel like sometimes I fail to get on track because I have to try for a couple of weeks. So what do you think about that?
So this is a really important thing. You have to be kind to yourself and understand that you are not going to do it perfectly at first, and you'll fail. And you have to accept that this is going to happen. And when we embark on treating insomnia, this is the first thing we tell our patients, is that this is not going to work right away. And in fact, you might even feel sleepier before you feel better, right? And you have to be prepared for that. But the techniques that we use, I would say the top 3 things. The top one is wake up at the same time every day, by far. Wake up at the same time, no matter how you slept. Get up at the same time every day, because what that does is it will cement your circadian rhythm so that it aligns with what you need to do when you go to work and things like that. One problem we often see is that people will get insufficient sleep Monday through Friday, and they'll try to make up for it on the weekends, and that is not a very effective math pattern. And if you met somebody like that, and you might even be that person yourself, you'll know that it doesn't really work, not as well as we want it to. Getting adequate nights sleep on your circadian rhythm when you need to be sleeping, that's the most important way to do it. So waking up at the same time every day. The second tip that I tell people to do is you need to relax before you go to sleep, right? And that means you need to do something that is not stressful, that you find relaxing to do. That could be knitting, it could be reading, it could be yoga, almost anything. And this is a very individual, you have to really talk to the individual about what it is that they think will help them fall asleep, and then go with that. I've had even patients tell me that, I had one patient tell me that they played little silly games on their phone, but it was kind of boring, and it put them to sleep. And it really worked for that patient. And so despite the blue light, it seemed to work really well for him. So we went with it. We're like, okay, well, that's what you're going to do. You're going to play your silly game until you get sleepy. You're just not going to do it in bed.
Yeah.
Um,
And I think that as an integrative medicine doctor, this is a really important message, is that you don't, you can't say, and one size does not fit all, right?
it
Dr. Emmy
doesn't.
and I
It
talk
doesn't.
about this all the time as well. And you can't just be like, well, this is what we generally do, so you can't do it differently. And even if it seems unorthodox, if it works for the patient, that's what's important, right? It got
Exactly.
them.
Exactly.
They'll put their phone down and fall asleep in a minute eventually. So that's what's important.
And that's what's the most important. And then a third thing. The third thing is really a funny one, but I like it a lot. If you're having problems waking up in the middle of the night, is that we don't want you to know what time it is.
Don't look at the clock.
And it's a really concrete behavioral change to make, but it's something that everybody can do. Like, I just don't want you to know what time it is, which means you're not going to pick up your phone, you're not going to look at the clock. Like, remove the clocks, turn the clock around, let the alarm wake you up. The alarm, just got to trust the alarm. It's going to happen.
Yeah.
Okay. You just need to not know, because what happens at 3 a.m. you wake up, it's 3:11 a.m. Okay, and you start doing math. How many hours do I have left to sleep? Doing math is not conducive to sleep. We need to relax and enter a timeless void between when you want to go to bed and when you wake up.
Yeah,
So that's
then
my
you're
third
stressing
tip.
about not being asleep, and that's keeping you awake as well. Just stressing about that.
Exactly.
That's amazing. Thank you, Dr. Robertson.
Yeah, no problem.
Dr. Emmy, what about you? Do you want to offer some tips or anything that you want to weigh in on what you've heard?
Well, one of the things that I tell people is that good sleep actually begins in the morning. So Dr. Robinson alluded to, getting up at the same time every day. But I also tell people to go out and ground in the morning and get out into sunlight to kind of set the tone for when their melatonin is going to be produced, to start the day in a way that's good. And, I'm a very busy person. I mean, I work more than 80 hours most weeks, but I have a pair of sandals in Seattle, in my room, and I open up my French doors and go out into the grass in the mornings. And I feel like that has really helped me. It's been like the singular thing that's helped me so much for sleep.
And it's also a calming thing, and it's a good thing to do, to just take a minute for yourself in the morning. I 100% agree. You might not have been on there when I was talking about your circadian rhythm, but one of the things that sets your circadian rhythm is bright light exposure after you have your sleep period, after you wake up in the morning. That bright light exposure is really important. We have a natural circadian rhythm that is slightly longer than 24 hours, which means, like, if you were to go, and in fact, we've done this, we've watched people that go into caves and let them work without clocks. And what happens is that they start going to bed later and later and later and later, because the circadian rhythm is slightly longer than 24 hours, which means we have to reset every single day. And so going outside and resetting with that bright light every single day, absolutely important.
That's
very, very important.
And Dr. Emmy also, she was an ICU, internal medicine ICU doctor.
Okay.
She's done her share of sleep disturbance. And for a long time, I was very worried about her because she could only fall asleep in her easy chair, and then she couldn't kind of make it to the bed. Sorry, Emmy, if I'm telling secrets to the world. But Emmy, what else did you want to offer? Because I think her sleep is so much better now than I've ever seen, throughout our adult life. So I know she's made a lot of strides and she's helped me. Dr. Emmy, anything else you want to offer? Oh, I can't hear you. Are you still muted, Emmy?
Hang on. So I think mind-body wellness techniques are also super helpful. The one I love, because I'm not a great meditator, is tapping or emotional freedom technique. I also like box breathing because it's easy, an easy relaxation method. So I do prescribe that to people a lot as a way of getting into it. I think, one of the things with mind-body wellness techniques, though, is you kind of have to have faith that they're going to work. If you're a disbeliever in them, they're not going to work, because they are tapping into your brain's power to help you. Yep. And so,
that's not
even though tapping
hypnotherapy, you don't have to believe in hypnotherapy for it to work. So
yeah, this is true.
That's
this is
true of tapping. And I do think that's true of a lot of mind-body techniques and even meditation. I feel like meditation has also been shown to work even if you don't believe it's going to work. Just the stillness of it does work on a lot of people. But hypnotherapy, you don't need to believe in it. You just need to actually do it, and it will work. But I think that's a really good point, Dr. Emmy, is that that for a lot of these things to work, you have to want them to work, and you have to believe that they work.
Yes.
And
it's important that the person buys into what you're doing. So No, that's a good point. Go ahead.
Go
I'm
ahead.
sorry.
Oh, no, I was just going to say the only other exception I can think of to this, except for hypnotherapy, is probably yoga nidra.
Yes.
I've seen that work for
Awesome.
people who don't really, quote, believe in it either.
Okay.
Exactly.
But yeah,
Which, as a
but
yoga
yeah.
therapist, I've also given that to a lot of people and designed specific practices for my patients for that. But that's the other thing, is that I've used yoga nidra in sleep disturbances, not of adulthood, but even of not only of adulthood, but of childhood. And people think that children can't do yoga nidra because it's like it takes some concentration and some following of the guided meditation. But I have done yoga nidra on children as young as 1 year old, and as long as they understand language, they do it, and it's amazing. So you're right, Dr. Emmy, it's very powerful. And yoga nidra is a specific type of yoga guided meditation.
Oh,
Go ahead.
awesome. Yeah, we don't do so. In sleep medicine, we don't have a lot of time to do that. But what we do is teach a very simple form of meditation. I'm glad you guys mentioned meditation because that's really important.
Yeah.
When you ask patients, like in our sleep clinic, well, you're having insomnia, what's going on? They're like, I just can't stop thinking. Right?
Yes.
I'm worrying, and not even worrying, just thinking about what you have to do tomorrow or this weekend or something like that. Like you have to stop thinking, right? We teach I learned this from actually a pediatric sleep doctor. We teach a very simple form of meditation. You simply focus on your breathing, and every time you breathe in, you think the word in, and every time you breathe out, you think the word out.
Yeah.
And it's not box breathing. That's
No,
too complicated. We just in and out,
it's
in
a
and out.
Buddhist exercise. It's
Yes,
a Zen
and
Buddhist
you
exercise for
just
Thich Nhat
and
Hanh.
every thought, if your thought comes, you let that thought go and you take another breath in and you think in, and you know you're doing it right. When you fall asleep, you don't remember stopping. You've done
Yeah.
it correctly. So that's how we teach meditation. I use that technique for all ages now because I think it's really
It's
simple and I
really
can
good.
teach it in about a minute. The You were going to say something else. So the other important thing to remember too is that people try to fall asleep, and trying is not how you fall asleep. Falling asleep is a very spiritual
It's
thing.
surrender.
We get a little spiritual about this. So when you have to let it happen to you. If you think about falling asleep, you're
Surrender.
letting this.
Surrender to sleep.
You're right. You're surrendering to sleep, and you really have to be comfortable enough with it. Which is why patients that have like post-traumatic stress disorder have I mean, almost 100% of them have sleep disturbances. And a big part of it is that they cannot surrender. They can't let go and fall asleep. And so teaching patients techniques to let go and fall asleep is a very important part of this. So
That's awesome.
yeah.
Dr. Emmy, anything else? Any other pearls of wisdom before we end our session today?
Well, when you ask for pearls of wisdom, it's a very spiritual. Just thinking. Uh, no, not really. But I think this was really great. I think, one of the main things that I actually come across as a doctor that works on body composition is sleep problems, because
Mhm.
people have such disturbances in the hormones that help you lose weight when you have sleep issues.
Yep.
And, it really increases ghrelin, which is a hormone that increases hunger, decreases leptin, which is a hormone that really helps to suppress hunger and tells your body to burn fat. And so I think this is so important on so many
And
levels.
cortisol.
And I want to, and
And
cortisol also.
cortisol levels. Yep.
Yes.
Absolutely.
So I want to thank you guys for doing this, because I think it's very important, and I think that a lot of people who follow me are going to have, a lot to learn from
Thank
this.
you for joining us and lending us your 250,000 followers. Thank you, everyone who joined us today. Thank you, Dr. Robertson, Dr. Emmy Hosoda, for offering their wisdom. And it's been my joy to host this. Drop any comments below, and we can individually and collectively cover them in future videos and lives. I post a lot about holistic health and yoga therapy and hypnotherapy and all the allergy stuff around that. Dr. Emmy does a lot about body composition, but also about hormonal regulation and about all aspects of holistic health. And Dr. Robertson, do you post about sleep and other things? What do you post about mostly?
I'm terrible about posting. I
We
never
got to get you
admit.
better. You got a lot of
Well,
knowledge to share.
now it's Sleep Awareness Week.
No,
It's
maybe
a
I
great
should.
time to start.
Yeah.
You've been an amazing contributor to this program, and I look forward to collaborating with you on our joint session at the American College of Allergy, Asthma, and Immunology annual meeting in October in Boston.
Yeah.
We're going to Boston, so there's going to be, very much a medical town
Yeah.
there.
Yep.
So hopefully it will be very well attended, and look forward to more collaborations with both of you. Thank you so much.
All right.
Thank you.
And thanks everyone for joining us. We had hundreds of people over the course of an hour join us, and we really
Awesome.
enjoyed having everyone here. And this will be available on all of our platforms in a few minutes, so that you can take advantage of it, even if you missed the beginning. Thank you, everyone. Take care.
Bye, everybody.
And get
Bye-bye.
great sleep. I wish you peaceful sleep. Good
Thanks.
night.
There you go.
Bye.
Bye.
Bye.